a disease that once claimed millions of lives each year. From the time of ancient Egyptian pharaohs to the 20th century, the terror of the disease known as smallpox left a profound mark on history. Yet, humanity achieved a remarkable feat by completely eradicating this disease in 1980, marking the greatest triumph of modern medicine. The COVID-19 pandemic emerged in late 2019. After 5 years of battling the pandemic, the coronavirus continues to silently attack communities. How are smallpox and the COVID-19 pandemic similar? What lessons does the story of smallpox offer? And how can we prepare for future disease threats? Join me, Mr. Know-It-All, as we explore these questions in the following video. Smallpox, the silent killer of history. Indeed, smallpox has often been dubbed the silent killer of history. Let's begin by exploring this disease and the extent of its devastation. Smallpox, caused by the variola virus, emerged over 3,000 years ago, with traces found on the mummy of Pharaoh Ramses V. It was a deadly disease with an average mortality rate of 30%, far higher than that of COVID-19, 1 to 3%. In the 20th century alone, smallpox is estimated to have killed approximately 300 million people, equivalent to the population of many large nations today. The symptoms of smallpox included high fever, headaches, and fatigue, followed by red rashes on the skin that developed into pus-filled blisters, often leaving permanent scars. Many survivors were left blind, infertile, or disfigured. The disease spread through close contact, respiratory droplets, or contaminated objects such as clothing or bedding. With an RO, the number of people infected by a single patient ranging from 5 to 7. Smallpox spread rapidly within communities, particularly in crowded areas. Smallpox spared no one, from royalty to commoners. In the 19th century, London of the United Kingdom, 1 in every 13 deaths was attributed to smallpox. The disease left an indelible mark on history, disrupting wars and wiping out entire communities. Historic victory, the eradication of smallpox. Humanity triumphed over smallpox through one of the greatest medical endeavors in history. In 1796, Dr. Edward Jenner invented the first vaccine by using the cowpox virus, a milder relative of the smallpox virus, to create immunity. This breakthrough marked the dawn of the vaccination era. In 1958, the World Health Organization, WHO, launched a global smallpox eradication program. By 1967, the Intensified Smallpox Eradication Program was established, marked by a rare collaboration between the United States and the Soviet Union amid the Cold War. The key strategy was ring vaccination. Instead of mass vaccination, health workers focused on vaccinating those in direct contact with patients and their surrounding communities. This approach was highly effective because the smallpox vaccine was nearly 100% effective, and the virus had no animal reservoir, spreading only through humans. In 1977, the last natural case of smallpox was recorded in Somalia, patient Ali Muai Malin. By 1980, the World Health Organization officially declared smallpox eradicated, a singular achievement in medical history. The success was driven by several factors. The smallpox vaccine was stable, requiring no refrigeration, making it easy to transport to remote areas. Smallpox was a symptomatic infectious disease, allowing for easy detection and isolation of cases. Global collaboration, from scientists like Viktor Zhadanov and Donald Henderson to thousands of frontline health workers, was instrumental. Comparison with COVID-19, similarities and differences. So, what are the similarities and differences between the COVID-19 pandemic and smallpox? Let's dive deeper into this analysis. When the COVID-19 pandemic erupted in 2020, the world faced yet another global health challenge. Although both smallpox and COVID-19 are dangerous infectious diseases, they share important similarities and differences. Similarities: transmission. Both diseases spread through close contact and respiratory droplets. The RO value of smallpox, 5 through 7, is comparable to that of the Delta variant of COVID-19, 4, while the Omicron variant of COVID-19 has a higher RO, 8. Role of vaccines. Both rely on vaccines to control the spread. Vaccination is key to reducing transmission and mortality. Global coordination. Success in controlling these diseases requires cooperation among nations, though the extent of collaboration varies. Differences. The differences between the COVID-19 pandemic and smallpox are significant. Mortality rate. Smallpox had a mortality rate of 30%, far higher than COVID-19's rate, 1 to 3% depending on the variant and region. Vaccine effectiveness. The smallpox vaccine was nearly 100% effective in preventing the disease, whereas COVID-19 vaccines, while highly effective, see reduced efficiency against new variants, necessitating booster shots. Reservoir. Smallpox was transmitted solely between humans with no animal reservoir, making eradication feasible. In contrast, COVID-19 can spread from animals such as mink or bats, increasing the risk of re-emergence. Vaccine development speed. The COVID-19 vaccine was developed in less than a year, thanks to mRNA technology, while the smallpox vaccine took decades to perfect. Approaches to combating the diseases. Smallpox. The strategy focused on ring vaccination, rigorous case surveillance and isolation. Global cooperation, particularly between the United States and the Soviet Union, facilitated the sharing of vaccines and resources. COVID-19. Measures included mass vaccination, social distancing, mask wearing, and widespread testing. However, a lack of global cooperation, example US-China tensions, and misinformation hindered control efforts. Despite rapid vaccine development, COVID-19 vaccines face challenges like vaccine hesitancy and the emergence of new variants. The story of smallpox is a testament to the power of science and global unity, but also a warning that humanity must not be complacent about disease threats. In today's interconnected world, highly transmittable pandemics like COVID-19, smallpox, or similar diseases remain a constant risk. Although smallpox has been eradicated in the wild, the virus is still stored in 2 facilities in the United States, CDC Atlanta, and Russia, Vector Kosovo. The risk of a virus leak or its use as a biological weapon persists, especially with advances in synthetic biology. The COVID-19 pandemic revealed that the world is not fully prepared for new pandemics. A lack of global coordination, misinformation on social media, and vaccine hesitancy exacerbated the crisis. Additionally, related diseases like mpox, monkeypox, with a mortality rate of 1 to 10%, serve as a reminder that similar viruses can still pose significant dangers. Preventing measures. To prepare for future pandemics, humanity must take the following steps. Vaccination. maintain stockpiles of smallpox vaccines such as ACA, M2000, and Janios, and invest in developing vaccines for similar diseases. Regular vaccination and research into universal vaccines are essential. Disease surveillance. Establish early warning systems and global disease monitoring networks such as those operated by the World Health Organization or the CDC to quickly detect outbreaks. International cooperation. Drawing lessons from the smallpox eradication campaign, nations must share resources, vaccines, and data to address common threats. Community education. Combat misinformation by raising awareness about vaccines and preventing measures like wearing masks, hand washing, and social distancing when necessary. Biosecurity. Strengthen security at laboratories storing viruses and prevent the misuse of biotechnology. The story of smallpox is a testament to humanity's ability to overcome its greatest threats. Once a disease that killed millions annually, smallpox was eradicated through science, global cooperation, and unwavering determination. However, COVID-19 reminds us that pandemics remain a present danger. By learning from the past, investing in research, and fostering global unity, we can safeguard the future from similar nightmares. Act now, get vaccinated, raise awareness, and together, let's build a safer world. If you found this video helpful, please support Mr. Know-It-All by liking, sharing, and subscribing to my channel. Goodbye, and see you next time.